Denture options have come a long ways over the past few years. We've gone from just standard, you always, in the past, you always hated to pull all of someone's teeth, especially the lower teeth if you had to. You just didn't want to, because like with an upper denture, a conventional denture is usually okay. What you've got is the ability of the denture to fit up in the roof of the mouth, so you get a good suction, and overall they're not usually a problem. Now that lower is a whole different animal. The lower denture is the one where your jaw is always lifting up and down, your tongue, every time you talk it lifts, so you're always lifting that denture, and not only that, on the lower you have just kind of like a horseshoe, a bone to put that denture on. Well, what has occurred over the last 10 to 15 years and become very significant is, in the past, you held off on taking someone's teeth as long as you possibly could, and if you did, you tried to save a couple of them. And if you could, that was great, but a lot of times what would happen is then that would break down and eventually end up full denture, and then life changes drastically for that person. Well, now with the advent of implants, we can put in 3, 4 implants in that lower jaw and put on attachments on those implants now that we can now take a lower denture and lock that in, and we've been able to get rid of so many of the discomforts and the difficulties that patients would face with just a good secure lower denture. And then they get to where they're liking that so much that now they're asking for implants on the upper denture as well. So that's an area of dentistry that has moved forward tremendously. As far as, if a person has to go to a denture, at least we've got means now to make it where their life just doesn't have to be that severely disturbed.